Welcome back to HealthWise. With us is Dr. Michael Felton, and we were talking about some of the dangers of not having the right testosterone level. Doc, you were talking about the prostate and how it's affected. Let's kind of touch that some more.
There was a long-term or long-held belief that testosterone was directly contributing to the development of prostatic problems, even prostate cancer. And even though studies have shown some linkage between elevated testosterone levels and prostate cancer once the cancer is there, there's no causal relationship between testosterone and prostate cancer. And what new studies are showing, and this is the Russian study that I have heck pronouncing the guy's name, it's Kaplesky or Pechersky or something long like that. But Pechersky's study was like 2001, 2002, and he showed that your estradiol levels, if they're not correct, increases your risk of BPH significantly, very, very significantly. And that
BPH for our audience. That's okay.
I'm sorry. Benign prostatic hypertrophy, which some feel could be a precursor to development of prostate problems, prostate cancer, and so on. You get obstruction of the outflow tract and all sorts of other problems as that prostate gland swells. It doesn't just grow out, it grows in and encroaches on your urethra, so you can't empty. And then you got to go see my friends, the urologists, for surgeries and medicines and all sorts of misery. The difficulty in not having a proper testosterone level is that estradiol level, which directly affects that prostate gland, is now out of control too. So your prostate is now being exposed to excess amounts of estradiol and ballooning and making you just one unhappy customer and potentially increasing your risk for cancer.
For prostate
so
cancer.
For those of my patients who are 35 and have any prostate family history, uncle, dad, brothers, anybody, I'm doing their levels then. And it's just, again, it's a safety and preservation of quality of life issue for them, okay?
Sure. Well, also we were talking a little bit about some of the other things that it affects. You were talking about as far as the mental acuity. I mean, I never knew that. I mean, I'm learning something here because never knew testosterone had anything to do with mental acuity.
It literally protects the neurons of the brain. I mean, it's like a protective raincoat or barrier to stop those inflammatory changes which damage the brain. There are studies that show that people with men with low testosterone levels, 5 to 10 years later, are at a 5 times increased risk of developing Alzheimer's disease. So you're thinking erectile dysfunction, forget that. What about Alzheimer's? Think about the loss of life for a 60-year-old man stricken with Alzheimer's. If you can protect him from that predisposition to developing Alzheimer's and keep that mental acuity and keep those healthy neurons, you've added a huge benefit and quality to his life. So, you know, everyone, like you were saying earlier as we were talking, erectile dysfunction, and I understand for a lot of men that seems to be the prime mover, but life preservation, you know, pushing that inevitable date where the good Lord calls you home back and improving the quality of those years before he calls you home is what anti-aging is really about. I know I'm not in this to make a bunch of muscle-bound 50-year-olds. Come on, that's silly. You know, and if that's what you want, don't come. That's not my guy. I'm not going to do anabolics for you. I want to use the knowledge that God's given me and the opportunity to meet all these experts in their fields to help the quality of life, give you more quality time with your beautiful family, and go forward and enjoy life.
Okay. And also, I mean, you know, we did say erectile dysfunction should not be your major.
No, but it brings them in.
It does. It brings them in. And I mean, as men, if you do have a problem, you should not be embarrassed to go and, you know.
Okay, you and I are losing our hair. Okay, part of getting old. You and I are going gray. Okay. We might have high blood pressure. Okay, but men have a phobia or stigma attached to saying, Doc. And the beautiful thing is the commercials, and you know, we were talking about how silly some of the commercials are, and the guy dancing around in the shadow and so on. But the end result is it's bringing men in, bringing their wives in and say, hey, I'm worried about my husband, I'm worried about myself, and it's giving me and other people who do what we do a chance to say, look, we're not just going to help you with that one important issue. Let's see if we can do this and prolong your good quality of life and make what life you have left better.
Okay.
So
that's a good reason. I mean, all the things that you stated should make all men, anybody that's listening to this should want to come and get tested.
Yeah.
Does the test cost anything?
Most insurance companies are paying for it now. And I mean, I know there's all sorts of falderall going on with what insurance pays and doesn't, but my girls have been doing this now. We've been doing the male and female hormone replacement aggressively the last 2.5 years or so in the office. We've been doing the aesthetics for almost 10 years or so since I got my first level certification. So we are doing it and getting it done through insurances. Okay. By and large, most insurance companies like the idea of people not having heart attacks and not needing dialysis and not needing, vascular surgeries and so on. So they're seeing it for what it is, was just not just a preventative, but a preservation of health. Wow. Activity. So right now, it's most of your good insurances are picking it up and go with it. Keep him healthy. Keep him back in the workforce. Heck, he can pay more premiums.
Sure. Sure. Well, Doc, like I said, we if for anyone that wants to come and get tested, where should they go?
Give us a jingle at the office, area code 337-684-3178. Ask for Christy. She is my super duper right-hand lady. She can do just about everything short of building the space shuttle out of bubble gum. So she's a pretty awesome lady, and she'll get you in. And Reg, I'm a big city kid. You and I grew up in similar environments. I'm an intensely private person, and I respect the privacy of my patients. So we even have special methodology for getting you in and out so that no one knows it's why you're there. And it's important that you can come in and get your checkup and get on back to your work. Right. We have a special rotation for our patients who are coming in for hormone replacement. Okay.
Well, like I said, audience, low T, you shouldn't just worry about it for ED, erectile dysfunction. It should be for quality of life. And Doc explained a lot of things today, and a lot of things that you can prevent. I mean, maybe even Alzheimer's, by having the right testosterone level. So don't be afraid to come in, give Doc a call, get a test, preserve your quality of life. And thanks, Doc, for coming.
Always good to see you, buddy.
Come back anytime. And audience, we'll see you next time on HealthWise.
Thank you.